Hi, I'm Ed. I'm your nurse. I'm gonna wash my hands. So wash. I'm cleaning my hands. I'm putting on some gloves. I'd like to ask your name
Abby Fensky,
and your date of birth.
July 20th, 1999.
Let me look at your ID band if that's okay. And I'm gonna make sure it matches my chart. Thank you, it matches. And I know that you didn't lie because you didn't look at that armband. It all came straight from you. Abby, do you know where you are?
Yes, I'm in a hospital bed.
And do you know today's date?
November 10th, 2017.
Okay, and do you know why you're here?
High blood sugar.
You had some high blood sugars. Okay, and what my purpose here today is to go over, head to do a little examination of you. We're going to do some testing of your hearing and some eyes, check some of your nerves, musculoskeletal system, and just listen to your heart and some of that. If that's okay with you, I'd like to do that.
Mm-hmm.
Okay. Going to start off with your vital signs. I'm going to take your blood pressure and pump and listen to your blood pressure. Oh, I guess it's on monitor. Boop. There you go. Turn it on. And while it's taking your blood pressure, I'd like to put on a pulse ox and take your oxygen, put that on there, and beep, it's done. So you're at 106/65, which is really good.
That's really good.
That's fine. And your oxygen saturations are at 99%. I'll take that off. It looks like your heart rate is about 70. So it looks like everything's going well in that department. I didn't notice any IVs, and you're not using oxygen tubing or any oxygen for your nose. So if it's okay with you, I'd like to start our assessment.
Mm-hmm.
I'm looking at your general appearance. You know where you are. Your skin looks good. You do not have a temperature. I'm gonna take your temperature underneath. Okay, there is no temperature. Your general appearance you look healthy. Are you in any pain?
No, sir.
And do you have any allergies? I forgot to ask you about
No,
that.
sir.
No. Okay. So what I'd like to do is start off by checking out some of your vision, if that's okay with you. Couple things for vision. Got my trusty dusty light, but I'm going to check your visual fields. This is for cranial nerve number 2. I'd like to check your vision field. So if you can look straight ahead, just pick a point there and look straight ahead. And if you can you see my hands over here? How many fingers am I holding up?
2.
You look. So you're not supposed to look. Keep an eye over there. So how many fingers am I holding up?
2.
Okay. And how many are over here?
2.
And over here?
1.
Okay. And can you see up to this top two?
Yes.
Up to this one? How many am I holding up?
1, 2, 1.
Okay, good. Next, I would like to take a peek at your pupils. I have my light here. If you could just look at that same point over the wall, I'm going to take a peek and see how your pupils are doing. Perfect. And we're going to come up and do that one too. One more time. So I'm checking, they're both round. They're both equal in size. They both react. Their accommodation is they both go at the same time. Constricting when they do that. So the next thing I'd like to check is your cranial nerves, facial nerves, and check a smile. Can you smile for me? There you go. It's a beautiful smile. And I'm looking for a symmetry that they're both the same and strong and nothing's drooping or anything like that. Hearing. I'd like to take the next step. I'd like to do a little hearing test. And we're going to check on cranial nerve number 8. And 8, I'm going to use a little tester and I want to see if you can hear that.
Mm-hmm.
Is that stronger that way or this way?
Not stronger.
Okay. And this side? Can you hear it?
Yes.
And do you hear it?
No, not as well.
Not as well. And the last one is right down. Can you hear both sides equally?
Yes.
Okay, perfect. So I'd like to check next cranial nerve number 11, which shoulders. Can you do, or head, can you tilt? Or can you look both ways? Okay. And then can you do a shoulder shrug for me? Perfect. And then the last one would be a cranial nerve 12 and a tongue thrust. Are you able to stick your tongue out? All right, perfect. Thank you very much. My next step is to do cardiovascular, and I'd like to check out your jugular veins. I'd like to listen to them. I'd like to listen to your heart also as it is. The first thing that we'll do is I'll take a peek at it and make sure that there's no distension. It looks even on both sides. You have good color, the skin, the warmth, it's dry. I'm going to actually listen to both sides. Okay, go ahead and hold your breath for a few seconds. Perfect. You can breathe. Okay, hold your breath. Perfect, thank you. I'm gonna just gently palpate it. And then I'll palpate this side too. They're equal. They're not bounding, and they feel good. The next one I'd like to do is just check your pulses all the way down your upper extremities. Okay, so we're gonna check a pulse. We have the brachial pulse. I'm gonna check the radial pulses. And then I'm gonna look at your capillary refill for your fingers, and they are less than 2 seconds. And I'll do the same thing. I have a pulse brachial, radial, and cap refill. That looks good. Thank you. I'd like to, your skin is nice and dry and warm throughout. I'd like to go ahead and finish palpating all the way down all your pulses. So I have femoral pulses. We're going to move on down and underneath the popliteal, and then feeling them also. Nice and strong. We'll the top of the feet, and then we're going to check the inside of the tibia here. I'm going to go ahead and check cap refill on your toes also. It looks good. There's no edema. Your skin is nice and warm. It's also dry, and that's a good sign, as it is too. Next, I would like to listen to your heart sounds and part of it. Okay, and if you don't mind, you can just lean back just a little bit. We're going to check the 5 spots. We're going to check the aortic. Nice strong one. We're going to check the pulmonic. We're going to work our way down to Erb's point. The tricuspid. You thought that was a tooth, didn't you? And then the mitral. There we go. And everything sounds strong. I do not. I have good sounds. You got the lub dub, and there's no extra adventitious sounds there. I'd like to check musculoskeletal system, if that's okay with you now. I'd like to just have your hands. Can you squeeze my fingers? There you go, good job. And then what I'd like you to do is kind of raise up against me. Perfect. And then press down. Good job. I'm going to move down the legs. Can you lift one at a time? Lift one leg and then the other. Now I'd like you to do it. Lift the right one. Perfect. And then lift that one. All right, awesome. Same with your feet. I'd like to have you press against me. Good job. And now pull your toes up for you. Perfect. Thank you. I'd like to, now that we've done the musculoskeletal system, I'd like to do your respiratory. I'd like to listen to your lungs. We're going to check the rate, depth. You're not having any problems breathing? No? So for right now, I'm just going to, you can relax, lay down. That's good. I just want to listen and count your breaths. And meanwhile, I'm going to start to listen. Down on the side. And down low. Okay. I'm going to listen to the backside. continuing all the way down to the bases, back at listening in bilateral, and making sure that they all sound the same or they're equal, and then this fact they are clear and equal. I do not hear any extra sounds or rubs or any kind of gurgling. There's no fluid. Does not seem like there's any fluid in your lungs. The next thing I'd like to do is I will have you lay flat. If you can lay flat for me. We're gonna check your abdomen. I'm gonna take a peek at it now. Then I'm gonna listen to it. I'll be feeling it with some soft touch and then with some deeper touches. Okay. Right now, it looks your abdomen is flat. There's no distensions. There is not like mine, but it is good. It's warm. It's tender. You don't having any pain in your abdomen? No. Okay. So I'm gonna listen to your abdomen now, and I hear sounds and. Must be lunchtime. Okay. And I do have sounds within the first few seconds, so they're pretty active. I'm going to touch it. That's okay. Just a light touch at this time, and I'm pressing any pain, tenderness. All right. And then I'm going to do some deep pushes to see if I can find some boundaries or see if there's anything down deep. Okay. Let me know if that's too hard. Is that okay?
Mm-hmm.
And I'm pressing really deep, and I'm feeling deep, and I'm going really deep. Okay. I think that is about all. Can I help you up?
Sure.
So, doing your assessment, didn't find anything out of the ordinary. Everything looks good. Your hearing tests good. Your neuros and musculoskeletal and everything is doing well as it should be. No problems with your breathing, and your lungs sound clear. I would like to talk to you a little bit about the reason that you're here for your sugar, your high sugar levels. Type 1 diabetes can affect that. You're aware of that. We want to make sure that you keep up with your insulin. Have you been? Are you on a pump?
Mm-hmm.
Okay. Make sure we enter in our numbers for the pump as often as you eat, or if it gets high. Are you testing 3 times a day, and at other opportunities when you feel high? Make sure you actually put that in there, and then we're going to exercise. And I want to talk to you about diet. Make sure that we're not having high things in carbs, no high sugar related items, and diet sodas. Is that correct?
Mm-hmm.
How do you feel about those items? Is that something that you can do?
Yes.
Do you have any questions for me?
Mm-hmm.
And I think I'm going to go ahead and take my gloves off, throw them away. I'm going to wash. And I'm going to say, is there anything I can do for you before I leave?
Nope.
And it's been my pleasure, and I will see you on the next round.
Thank you.
Thank you.